I'm Dr. Reza Movahed. I'm a regional cardiology director of CareMore in Arizona and clinical professor of medicine at the University of Arizona in Tucson and in Phoenix, and an invited speaker at the International Academy of Cardiology Scientific Session 2018, which is 23rd Congress on Heart Disease in Boston. My invited speaker is about preoperative evaluation of patient undergoing non-cardiac surgery. And this is a very interesting topic because we get this all the time as a cardiologist. We get patient to see for any type of surgery, and unfortunately this leads to a lot of cost, as many of these patients really do not need any further workup. In this talk and invited speaker, I will review the scientific fact about doing any studies in patient undergoing non-cardiac surgery. Most patients that have basically a good functional capacity over 4 minutes, they can just undergo any surgery and they do not need further testing. Actually, there is not a single class 1 indication in the guidelines in America to do any testing for just pure pre-op evaluation of patients undergoing non-cardiac surgery, because there are many studies has shown in asymptomatic patient performing a stress test, even in patients who are undergoing high-risk surgery, has not shown any benefit. There was a well-known study called CARP trial who evaluated patients who have a peripheral vascular disease with cardiac catheterization with the normal will function, and they randomized this patient to revascularization based on anatomy versus medical therapy. And in this large group of patients who underwent a high-risk vascular procedure and having a high-risk pre-op risk factors, in this population, performing a revascularization did not change any outcome. In this talk, I will emphasize the importance of evaluating the patient and preventing to perform unnecessary testing for this majority of patients who undergo non-cardiac surgery, as it will lead to a lot of cost and actually will not improve patient outcome.